members, where at the appointed time we have the quorum. Let's get it started. This is the meeting of Panel on Welfare Services. During the meeting, please note that you must use the virtual background. You must use the colored picture for your virtual background. And during the meeting, you must keep your camera on throughout the meeting. And all members will need to turn on the camera and display their image. If you need to raise a question or take the floor, please use the raise hand function on Zoom. We have the timekeeping on the screen. If the time is up, please stop making an intervention. This is an all remote meeting, so we don't have the access to sign language interpretation. We will add sign language interpretation afterwards. Documents, papers issued since last meeting. There are 4 documents. There is a joint letter from Mr. Stanley Lee and Ms. Lillian KWOK on the implementation of community emotional counseling services. Besides, there is another information paper provided by the administration on the proposed amendments of Schedule 5 to Disability Discrimination Ordinance arising from extension of government public transport fare concession scheme for the elderly and disabilities persons to cover eligible residential services. This document has been provided, and there is another information paper provided by the administration on the income limits of the Working Family Allowance Scheme. And there is another referral from the panel on administration of justice and legal services for your reference. If you don't have any further questions, we will now cover the items for discussion at the next meeting. The next meeting will be at 4 p.m., 16th of May. There will be 2 items for discussion. The first being the review on enhancement of the lump sum grant subvention system completed by, there is another item on the poverty situation in Hong Kong in 2020. Any questions regarding these 2 agenda items? Mr. Michael Tim, and then Mr. Tanka Piu. Mr. Michael Tim, please. Please turn on the mic for Mr. Michael Tim. Sorry, I raised my hand for the next agenda item. Mr. Tanka Piu, any questions on the items for discussion at the next meeting? Well, I didn't have any questions, but there is a high interest on the incident of the residential care home for children. We see that the children's residential homes started to recruit a new director. There seemed to be some reform and reports. At a proper time, we should invite the director for children's residential home to the Legislative Council to report on the matter. Yes, your intervention is noted. Thank you. Dr. Tiziyun. Thank you, Chairman. I agree with the 2 agenda items, but I just want to make it clear. As for the lump sum grant scheme, the document says that we need to discuss the item on the cut of 1%. Do we have to cover that as well? Because the 2 matters are different. I believe when we are discussing the lump sum grant, we will cover the matters that you mentioned. And you also proposed that we should discuss this matter, and we forwarded the intervention to the government. So we know that you wanted to discuss this. I believe the administration will also be prepared to answer your relevant questions. Thank you, Chairman. If there have been no further questions, item 3 on the proposal to appoint a subcommittee on policy issues. On 18th February, we received a letter from Mr. Lu Chonghong on setting up a subcommittee on promoting family education under the panel. Mr. Lu Chonghong, would you please introduce the document? If there are any questions, please feel free to take the floor. Mr. Lo Chonghong, please. Thank you, Chairman. According to the rules of procedure, we suggest that a subcommittee should be set up under the panel for welfare services to promote family education. Family education is by no means a new matter. If you were a parent, I believe you knew how important family education would be. It's also part of the traditional ethics of the Chinese nation. It's about building good characters of children, good habits, and their values. But with the changing society, traditional values have been under pressure. If both parents are at work, sometimes family education was ignored, and family education is dispersed in many different departments. Sometimes the Education Bureau, Labor and Welfare Bureau, and Food and Hygiene Bureau as well. So sometimes these are very dispersed pieces of information. The parents sometimes have no interest to participate in these meetings. I believe you know that very well. If you have any contact with the youngsters in the community, if we have young people who step on the wrong path, there would be some family issues behind, as always. And every parent is the first teacher for every child, every young person. I'm a parent myself as well. To be a good parent, to be a good teacher for our children, the government will need to offer complete supporting services. China was one of the pioneers in this regard. Last year, China, the NPC, published a law on promoting family education, and it stipulates very clearly that different departments of the government, including education, health care services, home affairs, and society-related agencies must support relevant work. China is seeing the emergence of a lot of activities in this regard, so we can offer good values to children, the next generation of young people. We believe it's imperative that Hong Kong should do this as well. This subcommittee we suggested would look at the implementation of relevant policies and collect different information from different places around the world, including Taiwan province of China, for our reference. We will also look into, within the current legal framework, we will also look into the legal responsibilities of the parents as guardians and how we can promote the new values for family education in the family council. We can also discuss how we can promote the status of family education and implement relevant policies, how we can support those families in need. For example, working parents, immigrant, and divorced parents as well. So we can promote the coordination of family education and other types of education. We can discuss how we can mobilize community forces. My experience is that we should mobilize the grassroots forces, community sources, to offer support. In the community, we must establish a network for family education and promote the importance of families' education. The key to family education is the training of relevant personnel, be it teachers, voluntary workers, medical staff, etc. If they need to promote family education, they need to improve their capabilities, and they should receive professional training as well. In this regard, we hope that in this subcommittee, we can cover these issues above. I hope that you can support this proposal and be committed to the establishment of a subcommittee on promoting family education. There are 3 members wishing to speak. Any other members who wish to speak? Today we have a very packed schedule. Mr. Tan Ka-pyu, Dr. Titi Yun, and Ms. Lillian KWOK and Ms. Maggie Chen. Mr. Tan Ka-pyu, please. I fully support the proposal by Mr. Lu Chunhong on the establishment of the subcommittee. We often jokingly say that you should have a license to be a parent. Dealing family affairs sometimes, if not done properly, will lead to tragedies. I believe the stories abound in recent years with increasing number of incidents. We received reports from the police force that the family-related incidents increased by 3 times in recent years. We hope that this subcommittee can integrate different resources from Home Affairs Bureau and other government agencies for a more effective mechanism. Thank you. Dr. Titi Yun. Thank you, Chairman. I fully support the proposal by Mr. Lu Chunhong, and I thank him for proposing such a good initiative. I followed the topic of family education for many years, but it was unlike China, who gave a priority to family education. I think it's a good thing. But one thing that we should take note of is that, more importantly, the government should support parents. It's not about the parents' roles, it's about the government support. We want our children to be good persons, but it's very difficult under current circumstances. We support parents to be good parents. And members mentioned that this initiative will involve many departments. In this panel, if there is a subcommittee, can we also take care of the responsibilities of other government agencies? If the other subcommittees or panels have the same idea, can we coordinate our work? I wonder if there is any ideal way to handle that. Thank you, Dr. Tisi Yun. Maggie Chen, please. Thank you, Chairman. I fully support Mr. Lu Chunhong's proposal on the establishment of the subcommittee. In 2021, President Xi Jinping made a speech on the importance of family education. But I'd like to give some views according to the mandate of this panel, and that is to highlight the roles of women in their roles of family education and formulate the viewpoint for national education. If women can help themselves learn about the national conditions, including one country, 2 systems and the basic law, it would be helpful to women in promoting their roles in educating our next generation. And it would be also conducive to the cooperation between different agencies on family education. If you look back on 2019 riots, we don't want that to happen again. So we must highlight the roles of women in Hong Kong's family education initiative. Thank you. Ms. Lillian KWOK. I fully associate myself with the proposal by Mr. Lu Chunhong. As other members said, in the past, the family education as an issue was proposed long ago, but it was divided by different departments like Home Affairs, Education, Society and Welfare Services. How we can coordinate the works of different departments, this is the first direction. Secondly, in Hong Kong, the reality is that in terms of family-friendly services and policies, it's a long due issue. We need to ask parents to devote the time and energy for family education. As Maggie Chen said, women have very important roles, but we can't tap into the workforces because they don't have any time. Secondly, I hope that we can take care of the counseling services for families as well. We hope that the viewpoint would be added. For example, if we find some problematic families, we can intervene as soon as possible to settle the problems. I think this is also one of the important concerns in family education. Thank you, Chairman.
Thank you. So several councillors have spoken in favor of the proposal. Are there any objections from the floor of setting up this relevant work group? Well, I don't see any objections. Any Anybody abstaining? No? Well, then I'll assume that everybody agrees, and everybody agrees setting up of this work group. Are there any objections? If there are any objections, please raise your hand. No. So then I'll ask the Secretariat to inform the Legislative Council Affairs Committee that we have agreed and consented to setting up this work group, and we would set up this policy study subcommittee, and we would think about the matters pertaining to the setting up this committee holistically. So if there are no further problems, let me just go to agenda number 4. It's the anti-epidemic work at residential care homes. So first, I'd ask all our secretariat staff to, well, yes, now you can raise your hand. So now I'll ask Secretary Law Chi Kong to offer a brief introduction to the relevant documents. Thank you. Thank you, Chairman. So this agenda item, well, we could say that over the past 2+ years, the LW and the Social Welfare Department, this is one of the most important parts of our work, our anti-epidemic work at residential care homes. And we can say that across the government departments, we are trying to reduce the amount of infections happening in these care homes. And we like to help the anti-epidemic efforts in the residential care homes. And we at the Labor and Welfare Bureau have a very important role to play. And of course, the Social Welfare Department, the FHB, and the Hospital Authority, we work all together and we cooperate to promote the anti-epidemic efforts in residential care homes. So the documents that I've submitted to you, it has quite a lot of content in it. I don't want to go through all of it one by one. So we have given an entire week's worth of time for everyone to review its contents. And of course, the information here is about the information on 25th of March, and it's been one week has passed since. So I'll mainly supplement 2 points, which is not listed in the documents. Firstly, with regards to an important part of anti-pandemic resources is the supply of RAT, rapid antigen tests. So starting from last year in December, we have been starting to distribute these RAT tests to the residential care home staff. But in the end, due to the lack of supplies, we can only offer them one test every 3 days. But now we have enough supplies to offer them daily tests. And approximately on 26th of March, we have provided these tests to certain care homes. If they have staff members or any of their elderly under their care being infected, then all the staff and everybody in the care home has to be tested. Another piece of work that we've been doing is that particularly during the peak in early March, well, we did what we can, and in the end, a lot of cases where there was a confirmed positive diagnosis, we are forced to quarantine them in situ. So how could we deal with these urgent health needs in a more timely manner? On the 31st of March, we have distributed 50,000 of these test machines to the 5,000 plus residential care homes. So this is supplementary information I want you to provide. I think there are a lot of questions from our councillors, so I'll hand over the floor over to our councillors. Thank you. Thank you, Secretary. We have so many councillors raising their hands. I'll read the order for everyone. So number 1 is Tek Chi Yun, and then Tin Pak Sun, and then Lee Sai Wing, and then Kong Yuk Fun, and Luk Chong Hong, Tang Ka Pew, Ngan Men Yu, Chen Ka Pui, Chao Siu Chong, Lillian Kwok, Luk Hon Man, Elizabeth Quat, Maggie Chan, Chao Bak, Leung Man Kwong, Len Chiyuan, and then finally myself. So time is limited, so we might need to postpone this meeting a little bit. I want to give everybody a bit more time to discuss, but we cannot overrun too much because by 1:30, everybody must leave the Zoom call to address the voting issue. So 4 minutes per counselor, I think, and I hope that when the secretary responds to our questions, that you could pay attention to the time. So once the 4 minutes are up, we will mute you. So the first question is from Dick Chi Yun. Thank you, Chairman. Thank you for allowing the discussion of this agenda during this meeting. I made this proposal on the 18th of March. That was when the pain was most serious in the residential care homes. And I hope that the government would deal with this issue as soon as possible. So it's a 7-page document with 5,000 characters submitted by the government. And Chairman, I cried as I read this document. If the government did so much things to help our elderly solve this problem, and amongst the 3,000 people who died, if a lot of people, if the lives could be saved, that would have been great, right? But these 5,000 characters, I was not moved by this at all. I've done a lot of report, and I like to report to our councillors. There was a cleaner named Ling. Ling, she was sick for a long time, and her father was also submitted to elderly care home because the elderly care home could provide better care for him. So the residential care home called Ling. Well, your father is not infected just yet. I will send your father back to your home, right? Is that better? And Ling thought, well, I have long working hours. I can't take care of my father, so I won't take him home, right? So in the end, she got a phone call. Her father was infected, and the nurse said, well, what kind of endemic conditions are there, right? We have partitions, right, separate all these elderlies. So she asked, does that work? Why don't you send him to a hospital? So the nurse said, the hospital is at full capacity right now. We cannot really call an ambulance unless the situation is serious. So, he was so-called therapy cared for in the care home, but really it was just, he just stayed there, and she tried her best to visit her father, but her father had a high fever and it's very difficult to communicate with him. And Ling was very anxious and hopes that the residential care home could arrange a hospital service for her father as soon as possible. But she begged many times and it didn't work. And she cried, it's a life, it's a life. Fortunately, after 2 days, her father got better, and all's well ends well. Another case study is a social worker at the residential care home. In March, there were a lot of outbreaks, and later on, 70% of the residential elderly in the residential care home was infected. They called the CHB hotline, tried to seek help, but there was no help. And in the end, after he managed to call someone, there was no specific help offered to him or her, and they were just asked to figure it out themselves. And more people was infected. And there was 1 week, there were only 3 members of staff and 1 chef who is healthy. And everyone was trying to help each other, trying to help work in the kitchens, etc., and do all that stuff. Due to shortage of manpower, this friend would call his friends for help. And in the end, there was a friend who delivered bread daily to the residential care home so that all the members of the residential care home could have bread every day, and during that period of time, the government was of no help. Chairman, I have so many more of these stories and reports. If people are interested, if the secretary wants to know, I could give him a copy. So, as we've said, if in February and March, if there are more injections, more vaccinations, if that could have been done in February and March, I think the situation would have been totally different. But today, as we know that we have missed the window of opportunity to help our elderly, I hope that the secretary will learn from the mistakes and try out their best to care for the elderly from their hearts. They are the needy people in our society. If we cannot help them, then who can we help, right? So I think time is up. There is no opportunity for the secretary to respond. So I hope that when the councillors pose their questions, they will try their best to give some time for the secretary to respond. Next question is from Tim Pak Shen. Thank you. So this serious problem in the residential care homes. A lot of people in the government should be feel responsible. Then why are you merely expressing your disappointment in the Social Welfare Bureau and in the Labor and Welfare Bureau? Just like on the 28th of February, I know that there was a residential care home who arranged for 100 vaccinations to take place. But in the end, the government said no. The government, and turns out the elderly were only vaccinated sometime in March. And furthermore, in the 24th of February, the governments have received the first batch of medicine, right? I understand that hospital needs are dire, but does that mean that you cannot give any of your medicine to any residential care homes? A residential care home in the Northern New Territories finally gained access on the 15th of March. Did the public hospitals use up all the medicine, or is it because they were not distributed properly? I guess the problem is that there is a lack of clear guidance and coordination across different government departments when it comes to the distribution of drugs. So when it comes to expressing disappointment, it's not just about the Social Welfare Department and the Labor and Welfare Department. Other departments must be included into the mix as well. And furthermore, early on the fourth wave, a lot of residential care home has raised a lot of issues, but the government did not respond. On the contrary, when the expert says that they have to reduce severe cases of COVID, now the government has ramped up resources, all of it altogether. I'm just curious, like, how come when the central government says something, the resources could suddenly be allocated to Hong Kong? Like, how long were those resources stuck in Hong Kong and nobody was cared to distribute it, right? If you distributed the resources as soon as possible in the early stages of the pandemic outbreak, could you have saved more lives, right? And finally, with regards to the government documents, the government says that there will be second phase of residential care home vaccinations. But right now, in vaccination in care homes, it's just as 53%. I would like to ask the Secretary, do you have a proper schedule telling us that when will they vaccinate the residential care homes fully? Secretary, thank you. I would like to respond only to the final part of the question because time is short. Our target is that by mid-April, we would be able to vaccinate all of the elderlies in elderly care homes. If they have the second jab, they could get the third jab. If they have the first jab, they could get the second jab. If there are any extenuating circumstances, for example, people who have recovered after the initial wave, we could also offer them a first jab. So the figures that you have just mentioned, particularly the vaccination rate of the residential care homes, because as a matter of fact, it has exceeded over 40% of the members of the elderly care home during the fifth wave of the pandemic. They caught the virus. So because they are infected during that period, we cannot offer them vaccination. So if you do the math, I think approximately 95% of the members of the elderly care home, they have either been vaccinated or previously infected. So does that mean that by mid-April, if you include the previously infected, you could help them get all three jabs? Is that it? Of course, if they were infected, we cannot immediately vaccinate them with the third jab, right? But we think right now, today, quite a significant number of the members at the residential care homes were not recovered yet. So I think that even before mid-April, we cannot vaccinate those people just yet. But most members, they have been recovered for some time. So what about the people who do not consent to being vaccinated? How do you deal with that? So today we have issued a letter at the Labor and Welfare by the SWD to all residential care homes with regards to the vaccination arrangements. So the most important thing we have to clarify with this letter is that if your family member is not a legal guardian, then the assessment of the doctors would be most important. If vaccination is suitable, then we will vaccinate. We do not have to listen to the opposition from a non-legal guardian. To put it simply, we would like to ignore the opposition from those non-legal guardians. Okay, thank you. The final member is Councillor Lam Chi Yun. So next is Lee Sai Wing.
Thank you, Chairman. First, to all the frontline staff at residential care homes, I pay my high tribute to them. I hope that next time the Secretary can also pay tribute to them and show your appreciation and mobilize them. We have over 700 residential care homes. There are 36,000 staff members who are infected. The number is concerning. We knew that residential care homes were faced with tremendous challenges. DAB suggested that the government should set up temporary centers. At end March, the government started building these temporary centers. But a couple of days ago, I contacted some staff from residential care homes, and it seems that there is some problem with its operation. So questions to Mr. Secretary. The usage rate of these temporary care homes is very low, 2 or 3%. Social and Welfare Department and the Health Protection Center, they have some coordination issues. So in this regard, what can you do, Mr. Secretary, to improve the situation? Sometimes the staff members have to wait for more patient beds, but in the temporary centers, it's the way other around. So how do you solve the problem, Mr. Secretary? Thank you, Mr. Lee, for the question. In this temporary care homes, you know, in mid-February, the emergency rooms were overloaded. So we started to set up these temporary centers. And on 20th February, we set up a temporary center at Chongming Road. On 20th February, hospital authority were faced with 2 problems. First, the emergency rooms were overloaded, so patients could not be triaged. And those who have recovered, those elderly persons who have recovered, could not be transferred to residential care homes or other care homes. Hence, they being transferred to temporary centers. The hospitals have seen alleviated burden right now. So in March, every day, these temporary centers received around 90 cases, and 60 of them were transferred by residential care homes. In any residential care home, for example, in recent days, there were around 100 new infected cases from each center, and they are either transferred to these temporary centers or to a hospital. If you look at past 6 days, there are 64 cases each day. I hope that the procedure can be accelerated. Thank you, Mr. Secretary. Thank you. The time is up. I hope the Secretary can learn from the proposals by Mr. Lee. Ms. Kong, I speak in favor of the motion by Lo Chonghong and the amendments by Tang Ka-piu. In the 5th wave of the pandemic, the elderly persons are hardest hit. These infected elderly persons being transferred to treatment facilities and residential care homes. The process was very chaotic, and the elderly persons had to wait outside in chilly weathers. And this situation, I believe, is still vivid to each and every one of us. As Mr. Secretary said, the hospital authority is busy enough, but can you admit that you have some responsibilities when it comes to the coordination between the hospital authority and this residential care homes. I received some reports that families lost contact with the elderly persons, and some elderly persons were not treated properly. They were not able to take a bath for 20 days, and some of them have skin problems. And some family members reported to me that in isolation quarantine centers, after quarantine for more than 10 days, these elderly persons lost extreme amount of weight. And in mid-March, I received some reports from family members, and I felt sad about these cases. And for those deceased elderly persons, thousands of them, to help those who are accountable for them, I believe we should, when the pandemic situation improved, we should have an immediate review on the capability of these residential care homes of dealing these cases. Mr. Secretary, to the deceased elderly persons, to their family members, can you please issue a public apology to them? As you know, in late February and early March, when the COVID cases were at its peak, all government agencies worked at their best effort and mobilized as much workforce as possible to push forward the work. In early March, at its peak, every day, we're talking about 73 residential care homes reporting new infection cases. We did everything possible. We mobilized every NH personnel we could to address the problem, but we could not address the fast increase of cases like a tsunami. In my opening remarks, I mentioned that first and foremost, the responsibility should lie in social and welfare department when it comes to taking care of the elderly persons. So when we are not capable enough of dealing with the avalanche of cases, the first responsibility should lie in Labor and Welfare Bureau. When family members are faced with the pressure in this process, if they need to look for someone, it should be the Labor and Welfare Department who will need to take care of the staff members at the residential care homes. Mr. Lu Chonghong, next one. Thank you, Chairman. Secretary, in the fifth wave of the epidemic, the vaccination issue and the infectious cases, be it Labor and Welfare Services Bureau or the staff members at the residential care homes, I believe they were hardworking enough. But was it possible that due to some procedural issues, those who should be vaccinated were not vaccinated? Only 50% of the elderly persons were really vaccinated. But what was the reason behind the problem? And asked some staff members, both frontline staff and management personnel from residential care homes or other healthcare services providers. Number one, some residential care homes did not encourage the elderly persons to get vaccinated when the pandemic just broke out. They thought that there would be complications, there would be side effects adding to their workload. And did the government explain to them, did the government take a robust initiative to encourage them to get vaccinated? I knew that things were improved at the first place. There should be a written consent from family members to get someone elderly to get vaccinated. And could we use other ways to get the consent? And must it be a written consent? And many elderly persons are waiting for getting vaccinated. And sometimes the facilities were not included in the list of eligible vaccination providers in government's list. It's not the case that these facilities were not able to get the elderly persons vaccinated. There are some small and medium-sized healthcare services providers who want to get involved, but there wasn't a tendering system from the government, so the social resources were not fully mobilized. So my question is, in this process, can the government review the process, and can the government propose further measures to increase the vaccination rate for elderly persons to 80 or 90%? And we should also offer information. Some people are not aware of their body condition, suitable vaccination or not. We should ask doctors to tell them that they are eligible for vaccination rather than waiting anymore. So 2 questions. Secretary, our document stipulated the relevant issues. Since February, we enhanced our publicity work. We asked medical staff to explain to family members of the elderly persons, hoping that they could agree with vaccination. But one thing that I should clarify is that it was not about one vaccination dose. The written consent or the objection were targeted at the first dose. I thought there was some misunderstanding, and I thought some residential care homes were there to offer clarification. As you know, when it comes to emergency work, we could not go through a tender mechanism to handle the process. If we had a committee for a tender mechanism, it should take at least 3 months or 6 months at maximum. So we could not go for a tender mechanism when it comes to emergency. So we look for service providers as soon as possible. Of course, in this wave of the epidemic, the vaccination hesitancy was extremely severe. We had a lecture where we hope that the family members could agree. Even after the lecture, some elderly persons, their families were still rejecting the idea of getting their family members vaccinated. Are there any other solutions? As I mentioned, as you know, at present, if these family members, if they're not legal guardians, as long as they can agree with a vaccination, we'll offer vaccination. And some of the elderly persons were already infected. I believe with half of the elderly population being vaxxed, in the future, I believe the vaccination rate when it comes to the first, second dose and third dose would be 90%. Deputy Chairman. Thank you, Chairman. Secretary, faced with the disaster at the residential care homes, we must confess that there are different agencies who should be held accountable. Health, hospital authority, and other government agencies should also take responsibility. I remember that last September, there were lotteries, lucky draws for vaccination, and people had high level of interest. But every day, we're talking about less than 10,000 vaccinations. I believe the whole society are regrettable about that, but we must review on our experience. Michael Tin said that there was not enough coordination between agencies. For example, some private hospitals told me that in early March, with more resources, and there were this Lianhua Qingwen capsules from other service providers, and there were other medicines provided by these healthcare services providers. We knew that maybe capsules were not suitable to the elderly persons, but other soluble particles may be suitable for elderly persons. And these are compound Chinese medicines recognized by the national authorities. Why couldn't we give the elderly persons this traditional Chinese medicines? Why can't we give this medicine to these residential care homes? Why can't we offer guidelines? These residential care homes are used to using Western medicines rather than Chinese medicine. So we should review on that and look at this lessons learned. We should review on possible guidelines where we can offer TCM services to this residential care homes. And second, my suggestion is that Mr. Secretary, can you promise that in 2 or 3 days down the road, you can look at the new infection cases in these residential care homes? Can you please offer a database that was established by the residential care homes? And third, can you please make a solemn promise that every infected elderly person from the residential care home can be transferred to hospitals without being transmitted further?
Well, I think the counselors, you are in contact with many residential care homes, and I think that the residential care homes are very willing to listen to your opinions. But when the government wants to offer a new guidance on medical procedures for residential care homes and new guidances, as the Secretary for Labor and Welfare, I cannot be responsible and I cannot offer them new medical guidance. But the government, it's very difficult for the government to say that, oh, I didn't hear it, so it's difficult. And particularly when it comes to prescription of drugs, I would offer those opinions to my colleagues so that they could handle these further. So even starting from the 18th of March, we have been, starting on that day, we have been selecting every day all of the relevant data which is reported to the government. We have been putting it on the database. So whether or not the database has all the information that Mr. Tang wants, perhaps we could talk about that a little bit further in the future. As I've mentioned, on the 28th of March, it's clear that all confirmed cases should either be hospitalized or they should be quarantined. Of course, sometimes there would be some exceptions, including, for example, you have to understand, for residential care homes, for these members of residential care homes, if they are asymptomatic or if the residential care home itself is suitable for quarantine, of course, that's a rare occurrence, that would be an exception. But overall, all confirmed cases, we would try our best to make sure that we either hospitalize those cases or we send them to quarantine facilities. Next is Ngan Men Yu. Thank you, Secretary. Thank you, Chairman. So with regards to the lack of manpower in residential care homes, that's a long-term problem. And during the pandemic, the problem is exacerbated. We can see that there's a disastrous lack of manpower in these residential care homes. And we have hundreds of members of staff from the mainland coming to Hong Kong to help us. And recently, with your help, the Vocational Training Council has offered 20-something training centers. We have been offering new courses to train a lot of Hong Kong carers. So I would like to ask the Secretary, what would we do in terms of following up on their employment? And after the pandemic subsided, how could we retain these hundreds, if not thousands, of locally trained carers to make sure that they could continue to serve in the caring facilities? Because as we all know, there's a serious lack of manpower in these caring facilities, and these hundreds and thousands of people who are lining up to be trained, how could we make sure that they can stay in this industry and develop their careers? Thank you, Chairman. So with regards to the VTCs, several weeks ago, they have been working hard to organize and promote alongside with some other organizations to offer an intensive training. It's like 21 to 24 days, 24 hours worth of intensive training courses. So a lot of these carers have found work already, and some of them will join our existing residential care facilities. So I think the overwhelming majority of these people will become part of the industry and work for these care homes. And under the training facilities under the VTC, usually, when they are offering these courses, they would follow up on these individual trainees for 6 months after their training to make sure that they could get a job in the industries that they're trained in. So as you all know, that under the pandemic, usually retraining work, a lot of the face-to-face retraining efforts have stopped, but some of the retraining in training for carers must be done face-to-face. Is not possible to be done in a virtual manner. But when we, due to the constraints under the pandemic, we have updated our guidance on training. So every day, for both the trainers and the trainees, they have to do a RAT test before they do face-to-face lessons. So we think that such work in the short term could help these residential care homes hire the staff they need. And secondly, as we all may know, right now, amongst the 45,000 members we need 50% more. In other words, we need 10,000 more staff. So, well, I think there can never be too much training, right? So anybody who wishes to be trained, you could be able to find a job in these care homes. Okay, so any follow-up, Edmund, you? So Chairman, I do. After the pandemic, how could we retain this staff and make sure that they continue to work for residential care homes? So this is a very important question. Ever since the start of the pandemic, in late January, early February, we know that the situation is dire. For many staff, they are facing a lot of pressure. So in our document, we have said how we could provide a monthly stipend to these members, to the staff members. And if for quarantine cases, all the staff members quarantined, they would have a $500 subsidy per day for each day of quarantine. Even though money is not a panacea, but we hope that we could incentivize these staff members to remain in this industry despite the many challenges in this industry we face right now. Next, Maggie Chan Kapui. So, this is Chan Kapui. In the fifth wave, 90% of the residential care home has seen infected cases, and unfortunately, 60% of deaths come from these residential care homes. We have lost many valuable lives. I think citizens of Hong Kong, like ourselves, we feel their pain. So the residential care home has overflowed in terms of capacity and creating a vicious cycle. A lot of friends told me that every day they still face a lot of problems. So I would like to ask the Secretary. So a lot of residential care homes, they are not suitable as a quarantine facility. So for these members who live there, they may face a higher risk of being infected. Would the Secretary try to review their current processes and develop better processes for these residential care homes? If the sixth wave hits, we could avoid the disaster next time. So beyond that, would you establish a guidance which guides the residential care homes as to how to take care of the recovered residential care home elderly, right? And there would be a lot of after effects due to the pandemic, and the residential care home industry would like to know how could they take best care of the elderly. So there's also a lack of gear and equipment. Like, for example, in the early outbreak of the fifth wave, all the residential care homes were allocated level 1 face mask. In the mid fifth wave, they got level 3 face mask. And during the peak of the wave, only the selected few of the residential care homes were allocated N95 face masks. Have you learned from these lessons, Secretary? And in terms of manpower, for the longest of time, the carers and the members, the ratio between carers and members of the residential care home is severely imbalanced. There's not enough manpower in this industry. Will the Secretary try to improve the import of labor force in order to cater to the needs for the industry and provide more opportunities for these industries to hire carers from the mainland? If yes, what are the details? If no, why is that? Thank you, Chairman. So during the fifth wave of the pandemic, the Social Welfare Department, with the help of the CHP, have offered guidance to these care homes. But as people understand that during this process, there is no room to offer training. So we have offered guidance, but whether or not the guidance were accurately implemented, I think that's a challenging situation. As for after being infected, how could we offer therapeutic services in the recovery process? That's an important thing as well. I think that we would work alongside the healthcare system to think about think about the issue of long COVID, right? Like, how could we deal with long COVID? How could we take care of the residential care home members who have weaker physiques? Like, I think the Social Welfare Department must work alongside the residential care homes to establish a long-term guidance. So in terms of protective gear, at the beginning, indeed, when we are trying to find if protective gear, it was quite difficult. And when the fifth wave hit, overall, at the governmental level, we have basically enough protective gear. I could tell everyone, I have once consulted the hospital authority. Could we borrow protective gear from the hospital authority and we could pay them back later in goods? Everybody is very anxious, right? Everybody's supply is tight. I understand the hospitals are at full capacity, but I thought there would be a sliver of hope that they could lend us a hand for a couple of weeks and we could give them back the gear 2 weeks later, but that could not be done. So overall, in Hong Kong, particularly at the government, at the hospital authority, and at the health bureau, and in terms of the protective gear that various departments need, there was a tight supply at the early phase. But afterwards, for N95 and all other types of protective gear, the goods have arrived at Hong Kong. So you know that at the beginning, we weren't sure whether or not well, even if we placed the order for goods, we weren't sure if they could be shipped from the mainland to Hong Kong, and that's another part of the challenge. And of course, the pandemic progressed rapidly. When we tried to procure such protective gear, it was difficult for all departments across the government. And the issue of manpower, as you all know, in the past many years, we have been saying that for subsidized care homes or for privately owned care homes, the manpower shortage is serious. For private care homes, even if they could ship manpower, import manpower, they would still have a 20% vacancy rate. Among subsidized institutions, for the long time, there's like 16 to 20% vacancy rates. Like there's a manpower gap of 16% to 20%. We have offered subsidies to those subsidize care homes and they could give pay raise, but that could alleviate the situation somewhat. But as you all know, our society is rapidly aging and the challenge will be exacerbated in the next few years to come. Enhancing the quality of service and optimizing the manpower structure, both are very important. Today, over 10,000 member of staff is lacking. We can imagine that in the next few years, we need a much more people. So in the mid to short term, we don't really, apart from importing labor, we can't really think of any other way to improve it. But of course, in the long run, we could improve this work and make it more attractive so that more local laborers could participate in this industry. But as you all know, over the past 2 years, basically, all our frontline staff throughout Hong Kong has been shrinking. The rate of shrinkage is very rapid. So this is a situation that we have to theoretically consider. We might need to consider importing labor. But as I have said, the short, mid to long-term policies, everything, we have to do all of it. We cannot depend purely on importing labor because that is not a long-term solution.
Next, we have many members on the waiting list, but we have a very limited time. So I hope you can keep your question short and to the point. Mr. Chou Siu Tong. Thank you, Chairman. Secretary, we're saddened by the outbreak of the epidemic in the residential care homes. The government were not doing a good job in supervision and coordinating. I hope the government can take lessons learned and prevent the same thing from happening again. I'd like to draw your attention to the shortage of labor at residential care homes. First, Mr. Aman Yu also mentioned the situation at residential care homes. I hope the secretary can look into the situation. We recruited 350 relief team members. We interviewed them and they had training. And we were one of the first institutions who started the training. And on the 30th of March, these people graduated. And I also followed up their recruitment situation. And I think the situation is a bit different from what you said, Mr. Secretary. When they're looking for jobs, the monthly salary is 14 to 16,000. They need to work 12 hours a day, but this is not right. When it comes to local workers, why are they working long hours? Second, regarding the $500 subsidy, many care homes said that they cannot receive the $500 subsidy anymore. The government policy seems to be that the infected persons have to be quarantined inside the care homes to receive the $500 subsidy. And faced with the situation, Hong Kong local workers it's not the case that they are reluctant to do that, but because of different limitations, including the salary, they can't do it. And we have some bad news. And that's some agencies who offer referrals that some residential care homes are reluctant to use local workers. And in the social welfare department, regarding the temporary positions, there are 5,500 applicants, but there are only 104 successful applicants, less than 2%. This is far from ideal. How do you address that? Second, we received many complaints that applicants have not received any response when they submitted applications for temporary positions. So 2 questions. Have you considered relaxing the conditions for the $500 subsidy or extending the time limits? Second, can you please think about importing labor? We're talking about 6 or 7,000 imported labor in the 2 or 3 months down the road, in the 2 or 3 years down the road, and this would deal a huge blow to local workers. Can you please review the temporary policies on importing labor? Thank you. Mr. Chairman, very briefly, if we are talking about $2,000 subsidy for if there are no person infected or quarantined, but the $2,000 subsidy are not related to that because it's from the anti-coronavirus pandemic fund. The $500 subsidy is for the close contact or person who've been infected, and they must have been quarantined to receive the $500 subsidy if they are quarantined on site. And as long as there is one person who needs to be quarantined, all the staff members will be able to receive the extra subsidy of $500. In private care homes and subvented care homes, there are differences in working hours. In subvented care homes, it's 8 hours, but in private ones, it's often 12 hours. There is also difference in salary. Early in 2021, the salary of subvented care homes was around 19,000 or 21,000 at maximum. So it's, in general, the situation in private care homes or subvented care homes, I believe it's a long-term issue which cannot be addressed in short term. As I said, the shortage of labor, the labor gap is over 10,000 across the industry. Even if we can import 1,000, 2,000, or even 4,000 workers, it's still not enough. So I don't see any possibility of impacting the job opportunities of local workers. Will you continue to offer $500 subsidies? If the epidemic is fully contained with 0 cases, then there is no reason to give $500 subsidy. We hope that the pandemic can be contained as soon as possible. But if there is any person being quarantined, we will offer $500 subsidy. Next one, Ms. Lillian KWOK. Thank you, Chairman. We regret that we lost many precious lives, and we are saddened by that. I had a case. There were some elderly persons at residential care homes. They need vaccination, but it was long due, and they got infected in February, but they passed away in late February. They strived for vaccination. They wanted vaccination, but it could not be arranged. Some care homes, very early on, in March, LegCo also said that the problems with the residential care homes were serious and they must be addressed as soon as possible. There were some care homes that said that they couldn't have services from the Social and Welfare Department. And some people said that if I have resources that can help the elderly, and back then I said, these people must be quarantined and enough measures must be provided. Protecting gowns and other supplies must be provided, but regrettably, we didn't see any of them. And here, I'd like to say what we saw was not only a problem of the Social and Welfare Department, because it was related to the whole package of work, including connection with the hospital authority. I know the Social and Welfare Department was only playing a supporting role, but there was some lack of coordination who led to these problems. And we saw the passing away of many precious lives. And here, you know, the fifth wave of pandemic is far from over, and we are faced with the possibility of new waves. If there were a sixth wave, I want to ask, with our existing system, as Mr. Tang said, how could we renew the guidelines for TCM in connection with the Department of Health, so we can offer TCM to the residential care homes? I'd like to touch upon supplies as well. When it comes to medical supplies, the staff members from social and welfare department were not following up enough, and they were waiting for the care homes to propose need. I believe the staff members from social and welfare department should also take the initiative to help the residential care homes. Thirdly, recently, emotional support matters. Emotional support to elder persons and their family members. And I believe the SWD can also offer some supporting services. And I would like to thank the staff members at SWD, because back on 18th March, SWD arranged for facilities at Choi Wan Road. And on 20th, we requested that manpower support should be enhanced to offer more workforce to the residential care homes. And SWD did properly and accordingly to alleviate the burden on residential care homes. I call your attention to these matters, Mr. Secretary. Thank you. We have very limited time, so your proposals are well noted. Next one, Mr. Benson Luke. Thank you, Chairman. Chairman, the residential care homes were hardest hit in the fifth pandemic. Apart from insufficient vaccination rate, another problem is the lack of manpower. Many residential care homes, the staff members were infected, and some residential care homes only have left half of the manpower. So no matter how hardworking they were not be able to face the situation. And 98.5% of staff members were infected, and many residents passed away. These are disconcerting numbers. These are not cold numbers. Mr. Chairman, if we read the government report in paragraph 15, SWD recruited some caretakers from the mainland, and we have 100 local workers and some imported workers. And we have imported workers starting the work first. Sometimes we didn't predict the administrative headwinds, but can the administration tell us, among the hundreds of imported staff members, how many of them have completed the training and started working at local residential care homes? Were they provided enough support? But this imported labor can only help in short term. We've been talking about the lack of manpower for residential care homes for 3 terms of chief executives. We talked about that in 2008, in 2012, and in 2015 as well. We started to talk about post-pandemic recovery. The government has been saying that we should increase manpower. They've been saying that for many years. Are there any medium to long-term plans to increase the local workforce? Can we consider importing more labor from the mainland or other regions? The Secretary, can you promise that there would be some detailed roadmap or timeline before the end of this term for increasing the labor force for residential care homes? Mr. Secretary. Mr. Chairman, regarding the manpower issue, as you are aware, the staff members recruited by the Social and Welfare Department are primarily working at temporary centers, as some members pointed out. When the temporary centers were built in late February and mid-March, the biggest problem was that we didn't have enough manpower. That's why we started to recruit manpower from the mainland or locally. And out of the 600 imported staff members, most of them are already working at the centers, and a small number of them are transferred by the Social Welfare Department to other centers, and the contract terms would be 3 months. We hope that the pandemic can be contained in 3 months, but if things doesn't go well, we will continue to extend their terms. And this time, the arrangements under the supplementary labor scheme, basically all these employees are under a 2-year contract term, and we will make use of this term to review our experience. Are there anything that should be improved when it comes to policy of a supplementary labor scheme? We will do some midterm review, but as you know, there are different voices. We need to take into account different voices from the community. Thank you, Chairman.
So please act quickly. Next, Elizabeth Kwok. Thank you, Chairman. So when the pandemic first hit, we know that the elderly are at highest risk. In 2003, after the outbreak of SARS, Secretary Law, you are the chairman of the PNP Committee of the Power and Privileges Committee of the Legislative Council. You know well that the residential care homes space is tight, the disease is very highly infectious, and it's a very high risk place. So even in this wave of the pandemic, there is still such a serious problem in the residential care homes. I think, Mr. Law, you know full well where the danger lies. But we are delaying the diagnosis of these residential care homes. We are delaying the manpower supply of these residential care homes that they direly need. We have 30,000 cases of infection, and 3,000 elderlies have lost their precious life. This is truly a painful event. So we see there's a trap before us. We are about to fall into the trap. What have we done? A lot of our counselors, we have received a lot of calls of help from many different families, and we've cried many times because we can't help them, right? Like, even if we deliver resources to those care homes as soon as we cannot save those lives in time. Has the government done all they can in order to save these lives? We honestly cannot see it. So that's why it grieves me to say this. Today, I want to ask the Secretary, in this moment, how many more confirmed cases do we have that are still stuck in the residential care homes? Do they get adequate medical attention? I have still heard from reports from these residential care homes saying that they have to use very primitive ways to quarantine the infected cases from the people who are not infected. There's no improvement except for the equipment part. I would like to ask the Secretary, would you promise, like, could we help over 90% of the members of these care homes to be vaccinated, no matter what means necessary? That's the only way you could help them. And furthermore, let's say if an elderly person is infected in their care homes right now, how long will it take for them to get medicine and get medical attention? Because I still hear reports, a 96-year-olds, who got infected, they used to be healthy, right? they don't get access to private healthcare in private clinics. They went to Prince Wales Hospital and they were waiting and waiting and waiting. They never got any dose of drugs before they unfortunately perished. You know, this is still happening right now. When will they have timely medical attention? How long will it take for them to get drugs? And furthermore, are there Chinese medicine available to all residential care homes? Is this part of their recovery program, part of their therapeutic program? A lack of manpower is not a problem that developed overnight, you know, and I was so mad when I heard the secretary say that this is not a short-term problem. Of course, this is not a short-term problem. We have started to talk about this ever since 2003. It was almost 20 years, right? Like, they have not been able to solve this problem over the last 2 decades. When will they be able to solve it? So I would answer that briefly. After the 28th of March, except for certain exceptional cases, for every confirmed diagnosis, they have either been hospitalized or quarantined. So very fortunate, you know, for some cases which predates the 28th of March, for those cases, they are still stuck in the care homes, some of the cases at least. So, but for all cases which happen after that, then as a matter of fact, they have all been able to gain access to medical attention. And in our work, particularly our outreach team, we have enhanced and strengthened all our responses in many areas. So Mr. Chairman, perhaps I shall not respond one by one, right? Why not let the councillors pose all their questions and then I'll answer them all at once? So time is short. We have spent too much time on the questions in the previous round, so I would shorten the time to 3 minutes per round of per question. So 3 minutes per question for all the councillors to follow. So next is from Maggie Chamanki. Thank you, Chairman. So in the 5th wave of pandemic, most of the dead are elderly. So the government cannot shirk this responsibility. The Department of Health's guidance, the hospital authorities' guidance has all exacerbated the pandemic in the care homes, and the vaccination rate of care homes is very low, so that it's very difficult. So no matter how much manpower we put into these care homes is for naught. And the recent reverse quarantine policies, they are the right things to do in order to avoid further outbreaks in residential care homes. But unfortunately, during the peak of the pandemic outbreak, the residential care homes were left on their own devices and a lot of elderly people perished as a result. Have you considered more proactive means to enhance the vaccination rate? For example, if the families have no justification to oppose vaccination, then the residential care homes could sue these objectors for their care costs. And right now, what are the utilization of these temporary quarantine facilities like? Would they become a regular quarantine facility? And will you consider using traditional medicine in these care homes as a pilot scheme? So right now, I heard that they cannot immediately remove the infected cases from the residential care homes in a timely manner. Would you set up a dedicated hotline to allocate ambulances to these residential care homes to take these elderly who are infected away as soon as possible in order to give them medical attention? And finally, the closed loop management of staff members who work for the residential care homes. It's very difficult to implement that policy. Do you have a solution? Thank you. Thank you, Chairman. Why don't I listen to all the questions and comments from other members first, right, before I respond? Because, Chairman, we have some, Secretary, we have some time. I think we have 6 more questions. So that would take 18 minutes and we would end the meeting about 12:30. I'm sorry, Chairman, because there are dozens of people waiting for me in Kwun Tong. Originally, I thought that the meeting would conclude at 50 minutes to 12. So, you know, I have many people waiting for me to continue our work. So, you know, I was just trying my best to listen to all the opinions of these councillors despite the overrunning meeting. So next, we have a question from Councillor Ng Chao Pak. Thank you. Thank you, Chairman. So the flaws in residential care home work is disastrous. As everybody alluded to, we could have avoided this. In the late year 2021, we were already saying that we should ramp up vaccination. But in the end, the government have given up on taking the initiative in public health policy, and that's the reason why there was a huge disaster. So what Secretary Law have alluded to, that they have to improve what they've done, learn lessons. That I think is an admirable thing. But I feel whether or not their policies are appropriate and whether they could be implemented, that's a very important thing. So I would like to ask the Secretary, in the future, no matter how you characterize your actions in terms of improvement, how could you improve? What will you improve on? One of the very important things is to divert these people into different medical facilities. How could you do that properly? The process, how do you divert these people and how do you schedule things? How could you implement it? Right? Like if you cannot do it, if it's not possible, why is that? We cannot just let these loopholes exist continuously. Lives are at stake. Another thing that a lot of people put a lot of emphasis on is the lack of manpower in these residential care homes. Back in year 2015, the Bureau has launched a pilot scheme for youth elderly care home service scheme, right? But this is a thankless job. It's a low paid and it's a long working hours and there is very little prospects, right? This is a problem which has persisted for a long time, and the social welfare and the Bureau has not bothered to solve this problem for a very long time. So I hope in the future the Bureau could conduct a comprehensive review on the manpower structure of these residential care homes. Well, importing labor, that's not a long-term solution. In the long run, we need local people to work in these areas. So the Bureau, apart from ramping up their training programs, would you consider introducing Gerontech to and improve the prospects of this job, improve the pay of these jobs to make sure that there's enough manpower to support our industries? So next, we have a question from Lungman Kwong. Thank you, Chairman. So this pandemic wave hit the elderly care homes, has caused a lot of unfortunate deaths. To a certain extent, this has to do with the 5 departments responsible for this policy area. They do not really care about these elderly people. They send them to the AWE to wait for dozens of hours and send them back home. Like, who is responsible for the formal policy being set, right? When face of these serious crises, everybody is trying to kick the ball and pass the buck. So in the past, one of the cases that we have looked into is a 90-something elderly person has waited at the hospital for over 30 hours, and then they have been allocated to the AWE and haven't had a shower for a long time and have to return to the residential care home. And in the end, we cannot serve them and we cannot help that elderly. And that elderly care home has asked the government for help. In the end, the government said this has nothing to do with us. We're not responsible. And in the end, the elderly care home has to seek for help across different hospitals to see that, do you have an outreach program? Can you help clean that elderly? Can you help offer that elderly any health care? And finally, fortunately, there was a nurse from the Kwonghua Hospital who were willing to come over and help. You know, this example and many other examples pertaining to drug administering that other counselors have alluded to, like how could we report these cases, etc. We can see that all these departments are trying to pass the buck, or the social welfare department does not have the expertise to handle these issues when there's a pandemic outbreak in the residential care homes. So I'd like to ask for the Bureau, in the future, when it comes to management of these residential care homes, would you consider working with the FHB or working with the Department of Health or other departments? If you have a proper coordination system where you could actually ask them questions, right? For example, when it comes to drug administering, be it a Western drug or a Chinese drug, would it be appropriate for the elderly? If there's one person who is willing to bear responsibility, if there's one group willing to bear responsibility, if they could say that this drug is okay or not okay, if that problem can be solved, a lot of problems could be solved at the very start, right? We don't have to wait for dozens of hours, right? Like for TCM, there's never been a response whether TCM is okay or not. So could you have a dedicated committee which tries to solve this problem? I want you to learn from your lesson. I do not want to see that across different departments that they work in silos. They would let other people handle other things which are not part of their purview. If that's their mentality, then they cannot handle the fifth wave, not even the sixth wave. When the sixth wave come, I think that they would face the same problems as well. So I hope that the Bureau could lead the way and take charge of this problem. Holden Chow.
Mr. Chow, your mic is not on. Am I coming through? Yes. Well, long stuff short. Regarding the policies for residential care homes, if there are less infected cases at the fifth wave, we should also think about how we can deal with the sixth wave. In the document, I see that there are only thousands of hospital beds at the temporary care centers. These temporary centers, we should get them prepared for the sixth wave. And if there were to be a sixth wave, we must have the hospital beds ready. Now you have recruited many caretakers, both from mainland and Hong Kong. I believe you need to keep them for some time for the potential outbreak of the sixth wave. During the fifth wave, we found that in these care homes, apart from insufficient hospital beds, even with isolation facilities, these care homes could not transfer their residents to hospitals because they didn't have enough manpower. So facilities and manpower, both are important. I think, Mr. Secretary, it's necessary that you should prepare for a possible next wave. As for TCM, many members expressed their opinions. We coordinated some Lianhua Qingwen capsules, but some care homes didn't dare to accept them because there were no guidelines from the Department of Health. Well, we could get access to medication, but we could not help the elderly person with this medicine. I hope the administration can take care of the TCM issue as properly. Vaccination. The vaccination rate is now only 50% among elderly persons. The Bureau says that many elderly persons have just recovered from COVID, so they could not get vaccinated. But there are still a number of unvaccinated elderly persons. We need to arrange vaccination for them as soon as possible. The doctors should offer initiative to help. If there is no reason not to be vaccinated, they must be vaccinated as soon as possible. We should take a one-size-fits-all solution so the vaccination issue can be solved as properly as possible. Next one is Mr. Lam Qiyun. Thank you, Chairman. Well, we need to take care of our elderly persons at our own homes and as well as of other families. I asked the same question at the panel meeting last time, and I said sometimes protecting children became abusing children, and protecting elderly persons became doing damage to elderly persons. However, the possible tragedy turned to be reality. We know that the Bureau took a big effort to improve the residential homes, and we knew that. But the fact is that across the world, the death rate in Hong Kong is at its peak, but the government didn't make it clear what the specific number would be. I hope that the government can offer more detailed information in public releases, giving a demographic analysis so we can look into the detailed situation. Well, on the other side, as a counselor, I also listened to other counselors' input. I was at 2 concurrent panel meetings back in February. Faced with the outbreak of the epidemic, I suggested that an emergent inquiry should be made to the administration. And then I withdraw the decision to make an urgent inquiry. But there were 2 questions. First, the issue is that we must be prepared for the future. The fifth wave of the pandemic is far from over, but we should get prepared for the 6th and the 7th pandemic. Some counselors didn't notice that I submitted a letter to Civil Services Bureau on the 8th of March because they were taking care of vaccination. The reason is that at the peak of the epidemic, the outreach vaccination team suspended their services. There were institutions telling me that the CSB told them to suspend the service for 2 months. Well, the Labor and Welfare Bureau and the Social and Welfare Department must coordinate the outreach vaccination services for the elderly. We must take one step forward to solve the problem. So these are the 2 issues. Well, the next question comes from myself. In this 5th wave of the pandemic, there are different works to be done, and everything will be related to the lives of elderly persons and the family members. I know, Secretary, you are having a busy schedule, and next time, if you have other commitments, you should tell me as early as possible, and I will arrange another meeting for that. In this pandemic, it also reflects that the government is very rigid in its operation. Sometimes infected elderly persons will have to be transferred to the hospitals, but the operation is far from being ideal. Some elderly persons are infected and they could not be transferred to the hospitals. When hospital authority was doing that, what did the Labor and Welfare Department do to address the problem? And how many elderly persons could go back to the hospitals or being visited by their family members? And as for the facilities which received close contacts, there were some close contacts who got infected, tested positive during quarantine. They had healthcare services nearby. So in Asia World Expo, many innocent elderly persons were infected. Did the SWD or HA have any problems in coordination? In this meeting, we don't have opportunity to learn what happened, and we don't have an opportunity to propose more suggestions as for the preparation for the 6th wave. I know we don't have enough time for that, and I know the next item will not be a hotspot issue like this one. So I did allocate more time for this item, and I knew that the secretary would have to leave the meeting for other commitments, but I hope that there would be sufficient time for the counselors to express their opinions. So, Secretary, I now give you some time to give some response, and we hope that we can discuss this issue on other occasions. And I hope if there were other opportunities, we should have further meetings on this matter at this panel. So you have the floor, Secretary. Thank you, Chairman. I listened to the opinions of many counselors, and many of them are related to the Labor and Welfare Bureau and our coordination with other government agencies. As you know, the permanent secretary of our bureau established a cross-department working group on the support for residential care homes and enhancing anti-pandemic measures. Coordination work will be enhanced and improved. Now the pandemic is not fully contained, but it's being alleviated. So we are taking every effort to deal with the new cases. How can we make sure that every case would be taken care of and receive medical services? We are exactly doing that. But we should also look into the future. I'm very happy that many members touch upon that. During the fifth wave of the pandemic, at its peak or even before the peak, we were busy preparing the facilities, but we could not catch up with the pandemic. In the second half of 2021, most of the time, our staff members were located in the facilities because we were preparing for the fifth wave. The staff members at the Asia World Expo were stationed there for some time, but it turns out that we can't deal with the fifth wave properly because it was a sudden and was like an avalanche. We know that the epidemic was very serious, much more serious than we estimated. At early March, after the Chinese New Year, when the epidemic quickly went for the worse, we knew that we could only seize the time and do our work as much as possible. But we needed spaces, we needed manpower, medical supplies. We could only pay our greatest effort. We hope that in the future we can get more prepared. And I thank all the counselors. To get well prepared, we should need more spaces which can be reserved for this purpose for a long time, and we need manpower for the long term. And please don't ask me how I spend money or how much or why we need to reserve these places, because without them, if there were to be the sixth wave of the pandemic, if we need to recruit people at a sudden, it would be impossible to fit the purpose. Mr. Secretary, if you have any questions unaddressed because there were no sufficient time, you can reply to this panel through other channels. I'm very sorry because I'm half an hour late for my another commitment, and we have to deal with a letter from Dr. Tizi Yun to discuss some supporting arrangements for the residential care homes. And this is the document 177. And Mr. Tanga Pugh also proposed amendments to the motion proposed by Dr. Tizi Yun. The letters have been provided. If you agree that we deal with this motion and amendments, do you agree? Without any objections, we would deal with this motion. Dr. Tizi Yun, please move the motion, and Mr. Tang Ka-piu will move the amendments. We will first of all deal with the amendments by Mr. Tang Ka-piu. Dr. T, please. Well, the document has been provided in written form, so I will not repeat it. I saw the amendments by Mr. Tang Ka-piu. The main content is the same as my proposal, so I will support it. But I will reserve my request for getting them accountable. Many residential care home staff members would like to have a discussion with counselors. We hope that this can be arranged. Next speaker, Mr. Tankapu, please move your amendments. Thank you, Chairman. The core of my amendments is about the disappointment and regret for government's dealings. It's not only about the Social Welfare Department or the Labor Welfare Bureau. It's about coordination between different government authorities, and there is a big problem with that. This is the key point of my amendments. It's not only disappointment. We hope that proper investigations would be done as soon as possible. Thank you, Mr. Tam. I have not received any amendments in written form from other councillors. So Mr. Tankapu's amendments is the only amendment. Now we will go for a voting. So we can vote by raising our hands, and the Secretariat will record the hands raised. First of all, we will deal with the amendments by Mr. Tankapu. Those who are in favor, please raise your hand. Secretary, please record the votes.
Okay, please record the votes. So if you're done, Secretariat, please inform me. Are we okay? Are we done? Okay, the record is clear. So those who oppose the amendment proposed by the Honorable Tankapu, please raise your hand. I don't see any hand raised. So those who abstain, please raise your hand. 1, 2, 3, 4. 4 people abstained. 1, 2, 3, 4. Yes. The Secretariat, please record those who have abstained. Are we done? Yes, we're done. The record is clear. So with regards to the relevant motion, I think the most people of the committee members are in favor of this amendment. So if the amendment has passed, and since the amendment has passed, there is no need to vote on the motion proposed by Dr. Honorable Teck Chi-yun. So the amendment proposed by the Honorable Tankapu has passed. Thank you, everyone. So time is short. I would extend the meeting by 15 minutes, all the way to 1 o'clock. Yes, our meeting will last till 1 o'clock. So the next item is about the annual briefing on welfare facility projects funded by the Lotteries Fund. So the Secretariat has already updated everyone on the background. So the representative from the Labor and Welfare Bureau will brief everyone on this issue. If you have any questions, please raise your hand on Zoom. So Mr. Hall Kai-ming from the Labor and Welfare Department, please. Thank you, Chairman. Today, we're going to report on the annual briefing on welfare facility projects funded by the Lotteries Funds in financial year 2022 and year 2023, and a briefing on the latest updates of the projects in the past year. So we plan in year 2022 to year 2023, we do apply for funds from the Lotteries Funds on 23 different projects. You can refer to the paper for details. So 9 of the projects about public housing, 5 of them about public private housing development, and 2 of them are for the Housing Authority, and two of them is from the Urban Renewal Bureau, and the rest is for the Special Site Scheme for rebuild and renovation of certain projects. So these projects provide various types of social welfare services, including elderly services. There are 16 elderly care homes, 8 community centers, and 16 elderly centers, and 11 handicap centers, and 2 integrated occupational therapy center, and 2 special needs children centers, and 6 nurseries, and other early education and other assorted facilities as well. So furthermore, with regards to the meeting on 14th of September last year, we reported on the latest development of the Lotteries Fund application for further funding. We have included it in Annex number 2. There are 7 elderly care homes, or 7 community centers and 30 handicap centers and 2 special needs children nurseries and 2 occupational therapy caring centers and 2 early childhood training centers, etc. So the government will continue to follow up on this work to implement all these social welfare projects as soon as possible. We will work on these many projects simultaneously. And in the we will allocate 5% of the total floor area of future housing for social welfare purposes in order to cater to the needs of society. Thank you, Chairman. So I see that there are 3 members who have questions. Any more councillors wish to pose any questions? Please raise your hand now. So after Maggie Chan proposed her question, I would stop any new questions from coming in. Maggie Chan, please. Thank you for your 4 minutes. Thank you, Chairman. I would like to offer a piece of advice. So the document mentioned that these social welfare measures have all have a consultation process, and a lot of them use the district council as the consultative body. So this is what the government have always done, and that's normal. But under the new electoral system, local groups do not limit themselves to the district council. There are various types and many types of different groups, different grassroots organizations. So in the future consultative process, would the government consider expanding the scope of consultation and in a regular manner put these groups as part of these consultative bodies? Thank you, Chairman. So through the Home Affairs Bureau and through that consultative system, we conduct our consultative process. Of course, we also have our own consultative committees as well, but the main stakeholder would be the social welfare representatives in certain regions. Of course, the district council is one of our most important partners, but we understand that the reality is that in each district council, they are operated by the district councillors, and we would talk to the Home Affairs Bureau to see whether we would purely depend on the district council or would we work with other frontline groups, and would that help our consultative process. We would conduct further discussions on that, but the most important thing is that we would like to conduct a local consultation. So when we construct these social welfare facilities, the locals would understand the importance of these facilities, and whatever views we would hear, we could collect these views from the public body and hope that the public would understand our policies better, and we would continue our work in a holistic manner. The district council is just one of the many ways we conduct the consultative process. So if there's no follow-up on Maggie Chan, we would have a question from Lok Chung Hong. A quick follow-up, please. So I hope that the Undersecretary would pay attention, is that because our new electoral system is diverse and improved legal system. So expanding the scope of consultative process is a good thing. I hope that you could cover more different facets of society in the future. Thank you. So Councillor Lok Chung Hong, thank you, Chairman. So the deficit of the lotteries fund is worrying. So last year, the report said the deficit is 2.5 billion. So I'd like to ask the government, based on the current trajectory, do you have a prediction? When will the lotteries fund dry up? Is that in the stars? So with regards to the 4 social welfare, would that impact the 4 social welfare projects funded by the lotteries fund? Would the lack of money mean that there would be less funding for these social welfare? So sometimes I think less budget is not necessarily a bad thing. Sometimes other ways to control costs might be an option as well. So would the government consider expanding the revenue sources? For example, the Mark 6 lottery, I think 50% of it will go into the lottery funds, if I remember correctly. So does the government have plans to allocate more funds into the lotteries fund, or in terms of investment, perhaps would they have investment items with a better returns so that the lotteries fund would have a more financial support in the mid to long term? And furthermore, when it comes to the bidding process of these projects or the bidding standards, right? We always thought that the service is most important, but assuming that the same quality of service could be provided, would we consider offering a more competitive way of bidding, including allowing some smaller and medium-sized enterprises and subcontractors to take these bids so that the overall bidding price would be lower, and to perhaps adopt a simpler design structure in this bid so that the overall costs associated with the project could be controlled better. So, for example, amongst these projects constructed by private developers, could it develop by these developers as well, so reduce the pressure on the lotteries fund? Thank you, Secretary. Thank you, Chairman. So last year in May, actually, with the Financial Subcommittee, when I applied for funding for the lotteries fund, we have discussed this issue. So the lotteries fund is slightly different from the other type funds. This lottery funds is a budget-based fund. We allocate a budget and deduct money from that budget. If we have run out of budget, we have no money to give to other projects, right? But the lotteries fund is also a cash-based fund, right? Like it has the amount of cash it has. So right now, indeed, firstly, the lotteries fund has less revenue than before because during the pandemic, there's less Mark 6, etc. That has an impact. So overall, we have less money. And in terms of expenditure, well, could we adopt various means in order to reduce the expenditure, in order, for example, expanding the scope of the bid? Firstly, we have existing mechanism when it comes to the bidding process and tender process. And secondly, this is not a for non-regular expenditure. This is not allocated by the lotteries fund. The lotteries fund mainly caters to non-regular expenditure. For example, the initial investment associated with a brand new project or renovation of a project. Usually for those projects, we would use the money from the lotteries fund. So for these non-regular expenditure, could we change the tender structure in order to reduce the amount of costs associated on that front? I would ask our colleagues to look into that in the future. I think on the face of it, because this is not a regular expenditure, like renovation, for example, like could you control the costs associated with renovation, just like that, right? From the face of it, I don't think that was a very effective way to do it, but we would look into the matter. Thank you, Chairman. So, Chairman Councillor Look Chung Hong, do you have any further questions? So, I think one of the things would be, I hope that the government could consider when it comes to increasing the number of revenue, there needs to be specific targets, right? Like, could we get more funds from the Mark 6 lottery or whatever? Because I'm really worried that the lotteries fund would dry up, and that would impact the services it provides. So thank you. I hope the Secretary will consider that point. So next, Honourable Dick Chi Yun. Thank you, Chairman. Firstly, Mr. Ho, I would like to thank you for during the pandemic, when the pandemic hit the residential care home, you're willing to pick up my phone call. I thank you for that. And I support your document. I support your proposal because these are important social welfare projects. As I recall, in the urban renewal bylaws, right, there is because for a lot of these projects, they may be delayed, and that would impact the services provided. So I hope that you could work with the Urban Renewal Authority on that. And furthermore, today I see that we are going to construct a lot of projects, but I do not see any comparison between supply and demand. Could you have a written submission to tell us for elderly care homes, disabled service, and other services, is there an actual demand for these services? And when it comes to allocating funds for these services, do you have a target in order to achieve best effect? As you have said, you hope you could allocate all types of services to achieve all ends. So I hope that you have a detailed written proposal for us to consider. Thank you, Chairman. I'd like to thank the Honourable Dick Chi Yun for his compliments. Actually, at our Bureau and at the Social Welfare Department, we will try our best to respond to the queries from our citizens and our councillors. So, we care. But overall, do we have latest prediction on supply and demand? I wonder if our colleagues have any numbers with them. But overall, we work in accordance with our 2015 to 2017 plans for social welfare. We have a relevant budget. But of course, the Hong Kong baby boom generation, there are a lot of people age 60 in the recent years, right? The coming of age, the age 60, when they hit retirement age. So the peak demand for Hong Kong elderly care home is not here yet. I think when the baby boom generation becomes old people, like they become 80-something years old, that would be when we would have peak demand for elderly care. Because the proportion of citizens age 80 and above will be quite high by then. So we have not hit peak demand yet. So do we have updated figures? I think right at this moment, we don't have those figures on hand. I see if our colleagues have anything to add. Oh, right now, we do not have the most updated figures yet, but based on our current estimates, we would continue to monitor the situation and allocate our existing resources to build more projects to satisfy the demand from our citizens. So Tech Chi Yuen, any follow-up? No further follow-up questions. Thank you, Chairman. So next we have Stanley. Thank you, Chairman. So Chairman, I'd like the authorities to respond to this point because for a lot of projects, they are still in the planning phase. And some of these projects, they are government and non-governmental collaborative projects. So these projects in your government plans, is there a schedule for these projects to complete them as soon as possible? If not, how could we follow up on this point to make sure that it would work, the work would progress quicker? So would the government support the progress of these projects so that they could be implemented as soon as possible?
Thank you, Mr. Ng. I believe you're talking about the land used for social welfare purposes of the private institutions whose land are allocated by the government. I believe the slow progress is not gratifying, but we will look into the possible measures to accelerate the process. The land plots were not owned by the government, so we can take measures to accelerate, but the institutions have to take decisions on their own first. So I cannot do that on behalf of them. The government would do as much as it could, but we need to wait for a decision from the institution before we can do that. And we will see if the assistant director can give some opinions on how we accelerate the process. Mr. Ng, do you have any follow-up questions? I hope there would be a timeline so we are aware of the demand and possible supply. In the annex to the document, we've included the possible dates of completion, but some projects we don't have information at hand. We need to talk with the NGOs. We don't have relevant information. We need to wait for the response. So some facilities, I hope that the assistant director can introduce to us the possible measures to accelerate the progress. Assistant Director. Thank you, Chairman. Thank you, Mr. Ng. Thank you, Undersecretary. For a long time, we've been keeping close contact with NGOs. We helped NGOs coordinate with agencies. For example, the architecture department can also offer relevant views, and under the lotteries fund, we can also offer subsidies for feasibility study or detailed designs. We hope that the NGO can develop the land as soon as possible. I believe there are some land plots a tender scheme at the high level, but we know from SWD and also Housing Authority that there will be some projects starting construction as soon as possible. So if we have enough financial resources, we can accelerate the process. Thank you, Mr. Chairman. Thank you. Without further questions, now we have reached the time limit. So our meeting will be closed. Any other business? Secretariat, any other business? If not, the meeting is closed today. Thank you for your participation. Goodbye.